Hi, I'm Emily Dale, and I'm a certified vet tech here at Angell Animal Medical Center in Boston, Massachusetts. I'm going to demonstrate to you how to give subcutaneous fluids to your companion animal. So here are the items I need to administer the subcutaneous fluids to Dakota. I'm going to first unwrap the bag from the plastic lining, and also the IV administration set. And take off this piece of paper here. And the first thing that I'm going to do is unravel this, and then I'm going to close off the two clamps that they provide you. The first you just push through, like so, and the second you roll down. I'm now going to hold my bag inverted so that the port is facing up. And I'm also going to hold the sharp end of the IV administration set. You're going to pull off both tabs and try your best not to touch any of those surfaces. You want to keep those as clean as possible. And easily just insert the sharp tip into the top port of your bag. You can then invert the bag and squeeze it a little bit just so that this chamber here starts to fill up with fluid. I'm now going to open up both of these ports so that the fluid runs down the line. So there's one port and there's two. And you can see the fluid start to flow down the chamber through the line. You might see some bubbles start to form. I'm going to use this to catch all of my drips. And you want to slowly run all the fluids through till you don't see any bubbles anymore. That looks good. And then you can close the port. All right. I'm now going to place the needle at the end of the IV set. You can twist off the port on the IV line and also twist off the tip of the needle, and they fit perfectly together. All you need to do is tighten this right here, and we're good to go. So Dakota's here ready for his subcutaneous fluids, and I have a partner here able to hold the bag for me, as gravity is going to make the fluids go a little bit faster. So Nick's going to hold the bag up there. I also want everyone to make note of the level of fluid, as this is important to keep track of because that's going to determine the dose of fluids that you're giving. You can also use a hook in your bathroom or a coat hanger if you don't have someone available to help you. And what I'm going to do is find a good spot on Dakota's back here to poke the needle into his skin. So this spot on his back between his shoulder blades is a good spot. I'm going to hold the needle in my dominant hand, and I'm going to use my non-dominant hand to kind of tent up the skin here between my index and my thumb. I'm ready to poke him with the needle. So I've taken off the cap. I'm going to put this down, and I'm going to gently tent the skin up and just pass the needle gently through his skin. When the dose has reached the appropriate level that your doctor's prescribed, we're ready to stop the fluids. I'm going to clamp off the line so that'll finish the fluids from being administered, and then I'm going to slowly take out the needle and recap it. And you've finished giving Dakota his fluids. Thank you for watching this video about subcutaneous fluid administration. For more information about our services, feel free to visit www.angell.org. Good boy, Dakota.